Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. So this is going to come out like a month after, but we have things we need to talk about because there's Super Bowl, there's Olympics, there's all kinds of things happening.
Well, I will start off by saying I had all of these gorgeous plans to watch Bad Bunny, and then I got caught up watching the Olympic replays and missed it.
Oh, no.
So I'm going to have to go back and rewatch it. I read all of the reviews and like how great it was. And so I've heard good things, but I just have not had a chance to actually watch it because I was watching figure skating. Sorry.
I know I need to go back and watch some of that, but it was very good. It really was. I enjoyed it. Like, I think a lot of people are echoing the same thing. Like, yes, I don't understand lyrics because I'm not fluent in Spanish. I maybe pick up a word here or there. Mm-hmm. But I got the vibe. I understood what they were showing us in the pictures, celebrating culture, celebrating all the little nuances of the people and diversity. And I just thought it was nice and it was positive and it was fun. And I was like bopping along. There was a moment where he sampled Gasolina. And I'm like, I know that song.
You're like, oh, I know that.
Gasolina. So it was good. It was, to me, it was different. I know there's lots of opinions, but I enjoyed it thoroughly. The game itself was pretty boring, so
I wasn't going to watch it for the game either way. But I feel like I like to listen to a lot of music that I don't know the language of because I feel like you still understand the emotion and the beat, and you can still get into it. So I don't mind listening to music even if I don't know the words, because it's not all about just the words. It's about the entire presentation, like and then when they're performing, a performance. I was a little confused on not having watched it. Exactly how did Lady Gaga fit into the Latina?
I don't know, but she sang one of her songs with that sort of a vibe, and she was in a very like retro. You saw the dress she was costume, wearing,
yes. And I'm not shading Gaga. I know she's Italian, and so I was a little confused about how that fit in. But I'm not anti-Gogs.
Where they popped her in there, it was worked. And then Ricky Martin, I was like, did not recognize him at first.
Did he La Vida or Locas?
No, he looks
or Loca or La Vida.
He looks very good, but I was like confused because how old is the man? I was like, wait a second, that can't be him.
He's older than we are. I know that.
Yeah. I mean, he's got to be in his 50s.
I mean, I feel like I saw him in an interview or something recently, and he was looking pretty good.
I was like, how is this happening? He has literally not aged. He might have gone backwards. Let's see, how old is he?
Just like black don't crack, brown don't frown. Mm-hmm.
He is 54.
Yeah,
but I'm telling you, he looked really good.
I had seen him on something before this, and he looked good. And I was like, well, good for you, Ricky. Good for you.
I was like, who is this young guy? And my husband's like, it's Ricky Martin. I'm like, what? But it was a lot of fun.
Yeah.
And then you mentioned, obviously, that you are watching Olympics. So
I am.
I enjoy that.
I've only been watching figure skating. I'm having a lot of conflicting feelings about skiing and Lindsey Vonn.
I know.
But I also remind myself, girl, you fat and sitting on the couch, so you don't deserve to have any opinions. I think my only opinion is that obviously, and she knew it's her body, she's doing it. It was risky to go into.
Right.
I just worry about what messages that's giving other Olympians or other athletes, when they're struggling through their stuff.
Right.
But I don't know. I feel like her message was positive and like, I want to do this. I'm doing this for myself. So hopefully there was no outside pressure from that. But we've seen it before with athletes where they have to basically compete or perform, depending on what the situation is while they're injured. And it can really cause career-ending injuries. I mean, she was going to retire after this anyway, but still.
Yeah.
I was thinking she had her left ACL ruptured.
Completely,
she had just had her right knee replaced.
Right.
And now the left leg is broken. I'm like, girl, you're not going to be doing anything for
You're not going to be
months.
walking.
Right. And then I was like, oh my gosh, does she have kids? Like, how's that going to, she doesn't have children. Not that it matters. It still sucks to be stuck in a wheelchair for a while, but at least she doesn't have like a 2-year-old to run after.
Well, yeah, because that would be absolute insanity.
I would hope she would have help if she did, but either way.
Yeah. So there was that. And then the ice skating. So I saw some things. I didn't see all of the things. I've been just catching the prime time where you get to see like the kind of highlights of things. And then last night, the prime time came on like after the Super Bowl. So I fell asleep and then like woke up and saw a part of it, but I did not like
I've been watching the replays on Peacock.
Yeah, I have Peacock. I got to go back and just watch a couple of things I missed.
I like with Peacock because they have it sectioned by sport, and then they have it sectioned by just the replay of like just the actual performances, or you can watch the entire thing like as it was happening.
Right, which is long and
I'm not watching the
right.
whole thing.
You just need the down and dirty quick stuff.
But I had watched Glitter and Gold on Netflix. Did you see that?
No, that's a documentary, right?
Yeah, so it was like the pre-Olympics. It was before the Grand Prix, which is right before the Olympics, like the top 3 teams. And they are the 3 that just the top 3 placements for the pairs right now. So it's kind of cool to be like, oh, they were like thought to, because it's France, Canada, and the US. So it's not like it was just US skaters.
Right.
But they kind of did fall in this range where like you weren't exactly sure where they were going to fall after the end of the documentary.
Yeah.
And it was like cool to like see their backstories and their personalities.
Right. Yeah, I have to watch it. That's something I'd like.
It was interesting. I liked it.
So this is something I was trying to get everyone to watch the other night, but we didn't get around to it. Do you remember the movie The Cutting Edge?
Girl, I've been watching all the ice skating movies. I watched the Boy Aquarium show, Heated Rivalry. I watched 2 really bad current ice skating movies. One was slightly better than the other. But The Cutting Edge, I mean, I don't know if I want to rewatch it because I feel like it was so good. But I feel like if I rewatch it, maybe then I'll see that it wasn't as good as I thought.
Yes, I know. It was, I put that and Cool Runnings as like those classic, just Winter Olympics type, like you got to watch them, the perfect cheese factor, but like also you're rooting for them.
Well, what I will say, on Netflix, there is an ice skating movie that actually came out, I want to say like 3 or 4 years ago, called Spinning Out.
Okay.
That one's pretty close to Cutting Edge. It's good.
Okay.
I just don't like it because it's only 1 season and it kind of like leaves where you're like waiting for more. And I guess they just never did more. But the 2 not good movies I watched all of Finding Her Edge, which apparently is based on a YA novel. So,
okay.
And it was renewed for season 2. I will say some of the acting was okay. And some of the acting was not okay. And then I was like, wow, this was produced by Netflix. Wow. Okay. And then I tried to watch Zero Chill. I couldn't even get through the first episode. It was just
not chill.
There was Zero Chill and Zero Chill.
Yeah.
I couldn't handle it. But Spinning Out, I recommend if you're into ice skating movies.
And of course, for the drama.
I'm biased, though. There's a mental health aspect to it. But go on.
For the drama, I'm sure you've seen I, Tonya before.
Oh, of course.
Yes. For the drama, you got to watch
I mean, I feel like people who were not alive at that time, what a time. What a time. What a time to be alive.
When ice skating was so important that we literally had hitmen trying to take people out.
I mean, I think one of my like dream costumes, I would love to cosplay it, but I don't think anyone would get it, would be Nancy Kerrigan.
Poor Nancy.
Although I feel like I'm definitely more of a Tanya than a Nancy. So,
but back that time, we talked about Sarah Bonelli, that Oksana Bayul. That was like that whole time period. It was so good.
Christy Yamaguchi. Yes. She was a little bit before that.
No, there was so many
names that are etched in our memories.
I know.
Well, and that's why I'm really loving the Olympics, because Johnny Weir. Yes. And Tara Lipinski with their coordinating outfits. Like,
they're too much. They are too much. I like that.
Every commentation, I don't even know that's word. Every time they're commentating and the matching outfits, it's like they're at the Met Gala, but like it's 2 PM in Italy, and they're not even like in the center of Milan.
They're literally like the friendship that we all desire with like our gay bestie. Like they are it.
They are. And I gotta say, I don't know if I ever truly appreciated Tara, like, for her personality. Like, I just knew her
Right.
skating because
Yeah.
that's all they let you know. But, like, she's a little spicy, a little saucy. I like her.
Yeah, I've seen things throughout the years of her and Johnny, like, with them together. So,
Yeah.
no, they're a
And
lot
I
of
will
fun.
say, when it's just Johnny and the other commentators, not as interesting.
Well, no. Yeah, you have to
Not
have
the
that
cute
play
back and
off.
forth. Although I was watching the pairs, the most recent one that was today, Johnny kept using this phrase, every eyelash has to be perfect. And I was like, only Johnny Weir can say that and be
He's
taken
so
seriously.
cute.
He is. He's fabulous.
Adorable. I think that's all the current events, that this will be a month later and people are going to be like, people, we are on to some other thing at this point. But hopefully it'll be warmer and we will be, this comes out in March, right? Yeah, like first or second week in March. So,
Girl, I'm tired of there being snow on the ground for the last 3 solid weeks.
yeah.
It's got to melt. I'm done. Oh, wait, before we move on, there's another ice skating movie. It's not new. You need to watch it. It's really good. It's called Harley and Katja.
Okay.
I'm not going to give you any spoilers, but it is a documentary that does not have a happy ending.
Okay. All right.
Like,
So I'm
was
just going to have to like look up like all ice skating movies and then the ones that you told me I'll have to go through.
Yeah, I actually watched it a while ago and I was tempted to rewatch it, but then I remembered what happens and it's just really upsetting, so I didn't.
Okay. All right.
But it's also, for anyone who listens and follows me, it is the entire reason why I watch ice skating. It's also the same reason I only watch gymnastics.
You want to see people fall?
Yeah. I mean, I don't want to see anyone get hurt.
No.
It's more just about like
the tension.
No, the reality check that this is hard ass stuff that these people are doing. And then it's like, wait a minute. No, this is hard, because they make it look so easy and so simple.
Right.
Like anyone can do it. And then it's like these Olympians, these people who have trained all of their lives to do this, and they still fall.
Yeah.
It makes it human, but it's also like, wow, like, yeah, you definitely can't do that because you're sitting on a couch doing that.
Right. I mean, I watch my kid all the time, and the beam makes me like cringe. Like, if we make it through the beam, like, we're good. Like, there's nowhere else that you're gonna really fall from.
I mean, this is forever ago, but when I briefly did gymnastics, I was obsessed with the beam. I loved the beam and I loved the bars, but I got too tall for the bars.
Yeah.
And then I got too fat for everything. This was when I was younger and I was much slimmer. I really didn't get heavy until like 5th, 6th grade.
Yeah. The bars doesn't bother me, like, because generally if something's going to happen, like, you're going to land on your feet. But the beam, there's all kinds of crazy stuff that can happen. In warm up, even just the other day at one of her meets, like, she literally, like, her foot just went like gone, and she just like took a header off the end. It was supposed to be her dismount, and like her foot just missed. It wasn't even like she was flipping yet.
Yeah.
Like, you okay? I think her coach sort of half caught her, but
I think it's different when it's your own child you're watching. When it's a stranger that you've never met, there's a little bit of safety distance.
Right. All right. What do you have for me today? I know what it is from like just the title, but.
Wow. Yeah. So the name of my drink, I almost lost it. I clicked the tab too quick, is the Tourette's Tippler. So that gives you a little peek of what I'm going to be talking about. I don't really know. It says.
It's a word.
It is. You may need a plaster cover. This is what it says. You may need a plaster. It's a British person that read this.
They mean Band-Aid.
You may need a plaster to cover your mouth once drunk in case of the sudden onset of Tourette's. This drink rocks. I didn't really fully get the accent right, but you got it.
Like you're tipsy, maybe? Maybe that's like...
I feel like a tippler is a word for something that I don't know, and I'm not going to look up right now. But it's pretty easy. It's 1 ounce of vodka, 1 ounce of Cointreau, 1 ounce of coffee liqueur like Tia Maria, not Kahlua because that has rum in it. You just want the coffee liqueur. Okay. And then a wedge of orange. So you crush some ice at the bottom of a glass, squeeze the orange segment over the ice, and then drop the segment in. I only had the freeze-dried orange, so I just did a little squirt of like lemon juice over it for the citrusy. But then you add first the Cointreau, then the coffee liqueur, then the vodka in that order. Stir it well. You're supposed to grate a coffee bean over the top, but I don't have any actually beans. I just had ground coffee. I wasn't sprinkling ground coffee on top.
No.
And then it says to serve with a straw and a sparkler. Bitch, I don't have a sparkler.
A sparkler?
It's a Monday night. We're not having sparklers.
Not like 4th of July. I don't know where I'd buy a sparkler currently.
No, but it's a Monday night. I don't need a sparkler in my drink. But I took a sip and...
That's quite literally all alcohol.
It's very strong, but I like the mix of the flavors. The orange with the coffee. It's a nice... It's a nice flavor. It's just, I definitely won't be able to drink that whole thing.
Okay. We don't need
Maybe
to go.
if I had like fresh squeezed orange juice to mix it with a little bit more, that would be good to like cut it.
Okay.
But I didn't have any. And I feel like the bottled orange juice, I like my orange juice chunky.
See, I do not. I don't.
I know. And a lot of people don't like it with pulp, but I like it with pulp. So I'm like, no, you can't have pulp in this drink. Work. You need like the watery stuff in this. So, but I didn't have it. So it's okay. But I enjoy the flavors of it. It's just a little strong for me. So I'll just be taking little sips throughout our talk. But what do you think we're going to talk about?
I don't know. Are you exploding to tell me about it?
I'm not exploding to tell you about it.
No, I know it's Tourette's. I know that obviously from the drink, but I've peripherally heard about this show, seen social media things about this person, but I've never actually watched it. But I'm very intrigued and interested.
So this is coming to you courtesy of Deb, my mom, because she's been watching the show for some time and she recommended it to me and I started watching it. And I have mixed feelings about it. I believe it's 2 seasons. I closed the link by accident about the show. Let me look it up so I can give you the details. So the show, if you guys haven't guessed, is called Baylen Out Loud. It is a reality TV show. It is 2 seasons. It started in 2025. So that was, I believe it was January of last year that it first came out. And it is following the journey of Baylen Dupree. And she is a young woman who is diagnosed with Tourette syndrome. So first thing I have to say about all this, because it was something I learned very early on in the show and did not know. It is Tourette, not Tourette's.
Yeah, Tourette's. Yeah.
Now, it is Tourette's syndrome, but...
Oh, because it's possessive.
Right.
The syndrome.
The man named Tourette named the syndrome, yes.
Got it.
But when we're talking about someone who has it, they have Tourette.
My mouth doesn't want to do that.
I know, my mouth doesn't want to do it either. And then I'm like, is this a trick? Because Tourette's mouths do things they don't want them to do?
I don't know.
Yeah, but that's what it is because in the show, her mom often says Tourette and is very like enunciating of it. And so I was like, wait, what? And then I looked up, I was like, oh, she's right. And I'm like, why would she not be right? But, it's just we're so used to hearing it pronounced a certain way. And I do still see it as Tourette's in many places. So it seems like the association, the organizations talking about their research and the diagnosis and the treatment, they call it Tourette. No S.
So that's kind of like my job, physician assistant. There's no apostrophe S on that, but everyone, even big newspapers, will write physician's assistant, but it is not supposed to be like property of the physician.
Well, I'm laughing because my dad would say he wants to go to Wendy, but he wants to go to Taco Bell's or Walmart's. Yeah, it was like he would add an S to things that didn't have an S and then not say the S when it was there.
A little flair.
I mean, I think part of it was he was just trying to piss me off. But so the show, as I said, it is following Baylen and her family. Her family lives in, why do I keep closing the wrong tabs? I apologize, folks. It's a day. So the show premiered in January 2025, as I was saying, and it follows her life. It really focuses mostly on Baylen, but also features her parents. She has 5 siblings and then her fiance, Colin. And then season 2 began in October. I believe it's still ongoing because every time I sign on, it's like watch new episode. Mm-hmm. So I don't know how many episodes are supposed to be in season. Oh, wait, it says on the Wikipedia 23 episodes. So
wow.
Apparently it ended in December. So I guess I'm only like 1 or 2 episodes behind. It looks like the last 2 episodes were like a 1-parter that they broke into 2 parts. So across the episodes, we learn about what Tourette disorder is, or Tourette syndrome. And we learned specifically about Baylen's case with it because several professionals in the field say that she has a particularly severe form of it and that her presentation of it is not the typical presentation. So I'm trying to think of where to begin because there's a lot of criticism of the show. I have some feelings about the show. There's a lot of drama, but overall, Baylen is in her 20s. I'm trying to see if it says it on here. She's in her 20s and she's got this boyfriend and he's in the Air Force and he's getting out of the Air Force and they kind of want to have their life together. They want to live together. They want to build a life. But at this point, when the show starts, Baylen's still living at home and, they're trying to figure out all these logistics. So part of the big drama in the first season is Baylen and Colin moving into their own place. Mm-hmm. And they're actually moving a little bit far away from her parents. So that's concerning because Baylen has several diagnoses, but Tourette is the big focus of the show. But I will talk about her other diagnoses as well. And so, according to the Wikipedia page, in 2022, she'd been a pre-nursing student, but then she was taking classes online because of the severity of her condition. But as far as when the show is showing, she's not discussing school at all. She's kind of just staying at home, chilling, doing stuff. But they do show that anytime she does go out in public or does try to do things, her tics are quite severe. And so you can see why maybe she wasn't able to do in-person schooling or pursue some of these things that other 20-somethings would be doing. So let's first talk about what Tourette is, and then I'll go back to Baylen and her drama, because girl got a lot of drama. Girl got lots of drama. So Tourette syndrome, which many people have heard of, is a motor disorder that begins in childhood or adolescence, and it's characterized by multiple motor tics, so that's movements, and at least one vocal tic. So the difference between just a regular tic disorder and Tourette syndrome is that you have both types of tics, where with a general tic disorder, you may only have one or the other, and it may not be as significant. Tourette, I'm going to keep messing it up. I apologize in advance for every time I say it wrong, but it used to be considered very rare. We're learning more about it, that it is actually not as rare as we think. About 1% of school-age children and adolescents are estimated to have it. But I think the one that most people think of is what we call, I'm going to pronounce it wrong, it's one of those days, coprolalia. Do you know what that is?
Is that repeating? Well, echolalia is repeating, so no, that's not it.
Coprolalia, blah, blah, blah. I feel like it's happening because I'm trying to talk about talking.
It's the drink.
That's what's happening. I smelled it and I took like a sip and a half. Coprolalia is the utterance of obscene words or socially inappropriate or derogatory remarks.
Right.
So it doesn't just have to be curses. And so many, 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 many moons ago, I met a little boy who had Tourette. And actually I met two little boys who had Tourette at two different times. But both of them had very clear tics, vocal tics. And their parents were considering them coprolalia, but I think in the grand scheme of things, they're not. Like the little boy, he would say like, oh crap.
No.
Oh crap. Like crap is not that bad of a word. I don't think it's fully socially inappropriate or derogatory or obscene. Yeah. But I think for a 4-year-old to say that pretty often is a lot. It was funny though, because that tic would get set off by almost something like intentional. So like one time we were playing and he was like building all these towers, and one knocked down. He was like, oh crap. But then it was like, oh crap, oh crap, oh crap, oh crap. Like over and over and over. Like he couldn't stop. And then I had another little boy who his was a little bit more of the coprolalia, where he would say, oh shit. But it was kind of funny because he hadn't even been formally diagnosed yet. It was just kind of a question mark. But I think like he knew it wasn't a good word to say, because he would kind of try to like mumble it.
Right.
But it would be very similar where it would start for a specific reason, or like if he heard somebody else say that word, he would repeat it and then he couldn't stop, which is very common for tics. They can be set off by things, or they can come out of nowhere. There's a really, really interesting documentary. I didn't do my research to find the name of it, but I want to say it's called Tic Camp, but it's about a camp for kids who have Tourette. And I did it right that time. And there's a really memorable scene where they're all in like the dining hall at camp, and just one kid starts ticking and then the other and the other. And then it's like this chorus essentially off, because everyone's been set off by it.
Right.
Which was really interesting to watch in that sort of documentary format, because I think a lot of people make these assumptions that it's being faked or being exaggerated. And when you see it like that, like these kids clearly didn't want to be doing this, but it was then happening. And then it made me kind of think like, if you're getting like 60 kids together that you know that have it, wouldn't you want to kind of control for some of that? But I guess there's only so much you can control for. Either way. But then maybe on the opposite end of things, since it was a camp for those kids, we don't want them to have to hold in their tics or prevent that stuff. So maybe it was almost freeing for some of them to be able to let it out without judgment.
Yeah.
And that's something that comes up a lot in Baylen Out Loud, is the judgment, the shame, the fear of the tics. She got some crazy tics. We'll get into that. So vocal tics are, like I said, it can be words, but it can also be coughing, throat clearing, making sounds like that.
Right.
The most common tics that most people have that are more of that, like 1% of all school-age children, are blinking, coughing, throat clearing, sniffing, facial movements. So it can be very small, like lip, mouth, facial movements. I would say most often I see blinking or throat clearing. And I will say it can be so subtle that you maybe don't even realize it. And I think that's what happens, why sometimes people don't get diagnosed till later, because if it's just throat clearing and you notice it in the winter, you're like, oh, they got a cold. And then in the spring, it's allergies. And then in the summer, oh, it's hot out. You can always kind of dismiss that stuff.
Yeah. I had just seen recently an older patient who I don't see him very often. He kind of just randomly shows up, doesn't follow up regularly. And I noticed that he was like blinking. You guys can't see this, but I'm blinking rapidly. He was blinking. And I'm like,
but is that TD?
Well, that's the question. Well, no, he's not on any meds like that.
Okay.
He's on
sorry, I should have clarified. TD is tardive dyskinesia, which can be facial or motor tics, but it's induced by medications.
But I asked him, do you know that you're doing that? And he's like, yeah. He's like, and I think it was that he was anxious in some way, and that's what set it off. Because I've seen him before, and I've not seen him do it like that. I've seen maybe a few times blinking, but this was like very rapid. But I do think it was set off. And I don't know if he has any other ones, any other vocal ones. But it's something, he's an older guy. He probably was never told what it is, that it is a tic. And then he's just been living his whole life doing it. And it can get set off when things get a little intense.
Yeah. And I will say, I think anxiety, stress, those can be triggers for those things. Being in new situations can be triggers. So I think sometimes you might see it more in one situation than another. And like you said, you'd seen him before, hadn't noticed it. Maybe that was a particularly off day, or he was getting results back, or something was kind of triggering that to come up more often than not. I actually saw an adult with Tourette's, guess maybe about 3 or 4 months ago, and his were very obvious facial tics, and he was very ashamed of them. And so, when we first met through telehealth, and so I did notice them, and I just asked, I was like, is this something you've been diagnosed with? Are you aware of it? And he said yes, and that it's always kind of been there. He had not been involved in any treatment for it, which we'll get into treatment in a little bit. But, for me, from a mental health perspective, when I see stuff like that, it's just kind of, you observe and you note and you move on. Like it's not interfering. It's not a judgment of the person. It is what it is. It's like, oh, someone has red hair, someone, or like observing that someone maybe has a disability. You just note it and you keep moving. Like it should not be impacting the other stuff that I'm doing, unless they were coming in specifically for Tourette, which in the past I have referred people out for that, because I think the better way to diagnose and at least identify that for the first time would be through neurology, through doing brain scans and seeing that motor movement and what's tipping that off in the brain. So Tourette, you're probably wondering, who was it named after?
Yeah. Well, here's the thing in medicine. A lot of these old guys things were named after, and then later on we changed the name because they did something bad.
Well, we haven't changed the name of this one yet.
All right. So
we haven't changed the name because it wasn't named after the doctor.
Oh, was the patient?
It was named after his intern, Georges Gilles de la Tourette. Guess what? He was French. How'd you guess?
We have a lot of French people in psych.
But you may have heard this name before. It was the intern of neurologist Jean-Martin Charcot.
Okay. Yes. Charcot foot and Marie Charcot tooth. There's lots of Charcots.
Yes, there's lots of Charcot stuff. I don't know if they're all related to this particular Charcot.
Yeah.
But he was a neurologist and an anatomical pathologist. So I'm sure a lot of things are associated with him. Mm-hmm. He's also known as the founder of modern neurology.
Wow. Yes. That's like a big title right there.
Yeah. Thanks, Wikipedia. I just thought he had a fancy French name. So this was identified in 1885. And then so he saw that his intern had it. And then they found 9 other patients who had a convulsive tic disorder. While the exact cause is unknown, it's considered to involve both genetic and environmental factors, and the mechanisms involved are the basal ganglia and other structures. So it's kind of something that is almost like a continuous feedback loop, continuing to go over and over and over again. So it is the most research apparently on Tourette syndrome originates in the US. I don't know why. I don't know. I don't know. It doesn't tell me why. But it is classified as a motor disorder. So that's a nervous system disorder that causes abnormal and involuntary movements. But it is also listed under neurodevelopmental disorders, typically because we would see it in adolescence or prior to adulthood. There is, like I was saying before, a spectrum of tic disorders, but Tourette is kind of considered the top because it has both the motor and the vocal tics, and they have to have been present for at least 1 year and occurring before the age of 18. So that's why it's neurodevelopmental.
Gotcha.
Tics in general are sudden, repetitive, non-rhythmic movements that involve discrete muscle groups, while vocal tics involve laryngeal, pharyngeal, oral, nasal, or respiratory muscles. So it's still the muscle movements, but now they're creating sounds.
Mm-hmm.
And they cannot be explained by other medical conditions or substance abuse. So certain brain disorders, if you have an injury to a certain part of the brain, it can kind of set off tics, but those would not be considered Tourette.
Now, is there a predominance male versus female?
I'm glad you asked that. I don't know. Let's find out. Let's learn together.
You know, it's one of those things. There's certain things that really are, or at least we thought they were. Maybe, you know, now certain things go undiagnosed in women, and then.
That is true.
But if it doesn't say there's a predilection to one or the other, then maybe there isn't.
I don't see it in my quick sweep over the Wikipedia page, but please correct me if I'm wrong, if someone else out there is listening and knows. Okay, wait. Most TS studies involve males who have a higher prevalence than females, but gender-based differences are not as well studied. However, a 2021 review suggested that the characteristics and progression for females is different, and so we need better studies looking at that. I don't know if you ever learned this, and I don't remember what class I learned this in, but that most disorders tend to happen in the male gender because of the double chromosome.
No.
And I'm like, I don't know how much.
But we have XX, they have XY, so they
I'm
have
sorry,
two different chromosomes.
I said it wrong because they have the different, it's weaker, where the double is like a stronger. I don't know if that's necessarily true. It was in one of my classes. I don't know how true it was. I learned some stuff in retrospect. I don't know.
There are inherited disorders because if they're carried on the Y, you know what I mean? That's only going to be...
No, this was just in general about why we tend to see more things in men. And my immediate thought to that question was because we study men, because most of the doctors are men, and so they care about men.
Right, they studied men for most things. But there are definitely disorders that affect women more. There are. It's just the studies.
Like the women disorders, like the ones involving
Hysteria.
vaginas and parts that the men don't have. Yeah. So there are a lot of co-occurring.
That was my next question.
Christ.
Co-occurring
or comorbidities. I was trying to say two words at once. So often ADHD, OCD.
Yeah, I could see that.
Which, if you're taking that step back, ADHD is an impulse control disorder.
Right.
And so your muscles are firing without impulse. And then OCD technically is also a sort of impulse control disorder where you can't manage that impulse to do the same thing over and over again, although they are kind of classified differently. OCD kind of falls more anxiety type.
Right.
But I can see where they could come. Anxiety and depression also co-occurs. OCD, there are different types of OCD. That's like a whole nother episode. There's technically 13 types of OCD. And that's more for, when we're looking at treatment, what are we treating? But certain things in OCD that might overlap with Tourette's is there can be aggressive thoughts in OCD. So repetitive aggressive thoughts. So that might be coming with, the comments that are being said. Maybe it's the thoughts that are going and that's tipping off the comments. Yeah. So those are the major things, but also mood disorders, substance use, self-injurious tics can happen. Baylen's got a lot of this stuff I'm talking about. So we'll
is
move back
the
around to her.
substance use self-treatment? Because this usually develops before age 18. So you're hopefully not a substance user before then, but maybe you're trying to dampen it with substances, like alcohol and opiates.
So it just says
benzos.
Among those with an older age of onset, substance use, but I'm also like, maybe significant substance use is affecting something in the brain, which is then tripping it off. But I would also think it might be a form of self-medication because I think there is a lot of shame and embarrassment associated with it. So of course, you want to relax. You don't want to be so nervous. You're going to have a couple drinks. And who knows, maybe when you have a couple of drinks, it's helping relax the system. I don't know all that kind of stuff. Something we definitely have to cover because we've mentioned it a lot. It pops up on here. Pandas and pans.
Yes.
So pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections or pediatric onset neuropsychiatric syndromes.
But then that wouldn't hit because it's caused, the tics would be caused by that. So it couldn't really be classified as Tourette, correct?
Well, we're classifying it by the presence of tics, not where they came from.
But you said it couldn't be explained by, I guess, a physical thing like a stroke, but I guess something like that.
Well, it would still be called a tic disorder or Tourette, but it would be due to other medical condition, which is always the specifier in the DSM for anything that comes up. There is the possibility of due to other medical condition and also due to substance use. So the mechanism, as I was talking about, I'm not going to go super deep into it, but all these structures are inside in the middle of the brain, so they're not easily accessible, but it involves the basal ganglia and the thalamus. And it seems to be that the circuits connecting them are kind of going haywire. This is very basic explanation of something extremely detailed that if you'd like, you can read it on the Wikipedia page where I'm getting it from. But it's there. Differential diagnosis, like we were talking about, dystonias, tardive dyskinesia, other dyskinesias. Tardive dyskinesia is just the type that we know is coming from a medication side effect, but there are other types of dyskinesia. I couldn't tell you what they are, but I knew that they were there.
Yeah, and also I would think that like a focal seizure could look like this.
Yeah.
Focal seizure, you can be awake but have like a movement.
Yeah, and you can have awareness. Yeah.
Right.
Yeah, so there's lots of other things that could look like it, but that's really why, like I said, I would refer someone out who's coming to me for diagnosis to neurology so they can really do those scans and see what's going on.
Full workup, right.
Yeah, other conditions that might manifest in tics, idiopathic dystonia, Huntington's disease, which I feel like that's a little different.
Yeah.
Like that pill rolling and that kind of stuff, but technically, yes, it's a tic. Duchenne's muscular dystrophy. Did we talk about that?
No.
I feel like I've talked about Duchenne's with someone.
I don't know. I mean, typically you're born with it and it's progressive.
Yes, it's a genetic progressive disorder affecting predominantly boys. Speaking of the boys.
Yeah.
Carbon monoxide poisoning. Interesting.
Okay.
I mean, I feel like if someone's got really bad carbon monoxide poisoning, they may not survive for us to see tics, but
yeah,
I'm just being honest.
Yeah, yeah.
Tuberosclerosis, which I know very little about. Wilson's disease. I do know a little bit about Wilson's.
Kaiser-Fleischer rings. Sorry, those are things I have to memorize.
What are Kaiser-Fleischer rings?
The copper buildup around their eyes.
The only thing I know.
That's the test question. That's
okay.
It.
Interesting.
If you see Kaiser-Fleischer rings, it's Wilson's. The end. Period.
Interesting.
And they finally saw it on House. So
nice. Now, is Wilson's also the one where they grow very tall?
No.
Okay. Because I had someone recently, he was very tall.
Marfan's or...
No, he didn't have Marfan's. He was coming in for an autism evaluation, but he had some other genetic syndrome where he was very large. No, he didn't have Klinefelter either. But he might have had XYY.
Okay.
Yeah. But he, one of his intense interests, along with his autism, was medical knowledge. And so he had all of this stuff about, well, I think maybe I have Wilson's or I have this or I have this. And so maybe he's the one who talked to me about Duchenne's.
Maybe.
It's very, he was extremely smart. Like it wasn't just he researched this stuff, like he truly understood it and the mechanisms and could explain it. And
wow.
Fascinating gentleman. Wherever he is out there, I hope he's doing well because he was actually a very sweet guy. So Tourette's. Should I loop back to Baylen and then hit treatments?
And I actually looked up a little bit on treatment too, so I can speak to the meds a little bit if you want to loop back to her and then you tell me about the therapy end. And
so we pretty much defined it already. There's not too much more to talk about it. Echo speech or echolalia, like you were mentioning before, that's a little bit different. It can be part of a tic, but it can also just be in and of itself. We tend to see more echolalia on children on the spectrum. There's also palilalia. Do you know what that is?
No.
That's when you repeat your own words. So you would say the same word over and over again, typically at the end of a sentence, at the end of a sentence, at the end of a sentence. That's what it would look
I've heard
like.
that before, but I didn't realize that's what it was.
That is palilalia. So we did all the co-occurring stuff. I linked a lot of stuff because the Tourette Association of America has an amazing website. So I put a lot of links on there, but there's a little bit of repetition across things. So let me close out the stuff we already talked about. We're going to talk about treatment. We talked about what it is. We talked about motor, focal tics, prevalence. This is what we were talking about. So like I said before, about one in every 160 school-age children. It's nothing to sneeze at.
Yeah.
Because if you think of a big school might have 400 kids.
Right.
So yeah, that's a couple of kids there. It is 3 to 4 times more common in boys than girls, just like we were talking about before.
Right.
Maybe it's just noticed and addressed more in boys.
Right.
It is what it is. No judgment to the boys out there. I'm glad you guys are getting treatment and identified, but
Right.
a lot of things go undiagnosed in girls and women, unfortunately. There are no reliable prevalence estimates for Tourette and tic disorders in adults, which I think is interesting. So I'm wondering if maybe it's because the parents are bringing them in for treatment and, following through. Maybe once adulthood comes in, there's less continuity of care.
Or it's kind of like they've just been doing this their whole life, so they're not necessarily asking, or they've become used to it. Like if it's, just like a motor, I don't know.
So this follow-up sentence says the impact of tics are expected to be much lower in children as tic severity tends to decline into adulthood. So I guess it's not happening as often in kids, but when it does, it's noticeable. And then in adulthood, it might be happening more, but it's not as blatant.
Yeah. I can picture another patient of mine actually who has like a winking, wincing face thing. And it's just kind of part of who they are. And whatever.
One thing I will say, just because it came up recently with a different patient, nystagmus is not a tic.
Right.
That is something very different. I had a patient who had nystagmus, and their parents were telling me that their eye doctor told them it was a tic. And I was
nope.
That's not a tic.
So nystagmus is, just for our listeners, like a rapid eye movement that can be associated with ear things, can be associated with brain things, but
it can have a lot of different roots, but it is definitely something that it can impact your vision, your balance, all that kind of stuff. With this child, it was affecting their social skills because at first they weren't aware of it, but then once it was pointed out to them, then some of the other kids started teasing them, so then they weren't making eye contact anymore and they weren't socializing, and so they're like, oh, we think they have autism. Like, we'll take a look, but there's a good reason why he's not socializing in it. It's not due to lack of skills. It's due to being shamed for this other thing that's going on. Yeah. He was such a sweetie. Oh my gosh. So other co-occurring conditions, I just want to hit this because it's interesting. Behavioral or conduct disorders, which I think goes along with what I was talking before about that impulse control.
Right. Mm-hmm.
Anxiety, learning disabilities.
Okay.
That, I think, loops into this next one, sensory processing difficulties. Right. So maybe some of those other difficulties with sensors are then impacting learning, which then becomes this whole thing. Social skills deficit, social functioning. We'll talk about a little bit of that with Baylen when we loop back to her in a minute. And sleep disorders. I would assume the sleep disorders definitely is because if your body's constantly making these movements, it's hard to settle down and rest.
Relax, yeah.
Yeah, hard to relax. So my girl Bay.
Yeah, let's hear it.
So Baylen and Colin, they go and they move. They got their own apartment, but even looking for apartments was like real rough to watch because Baylen has got all the kinds of tics. She does have self-injurious tics. So then they're looking at how much glass is around here, like what can she injure herself on. She has a lot of vocal tics and a lot of the coprolalia. So the one apartment they looked at had a balcony and they're touring it, and she goes out on the balcony and starts like screaming offensive things at people on the street. And it's kind of painful to watch because like it's happening and she's like, oh God, make it stop. And it's like happening again and again. No. And yeah, I will say some of her tics though are hilarious. She said one of her common tics is Joe Biden wants to suck a dick. Something about George Washington wants to suck a dick.
Okay.
Yeah. She has a lot of tics. A lot of them are real wild. And then some of them are just, making sounds, a lot of facial movements. She will become, like I said, self-injurious, so hitting herself, banging her head. She also has pretty significant OCD and ADHD, which comes into play when we talk about treatment later because it limits some of her treatment options because treating one thing may make something else worse.
Yep.
Another thing that she goes through a lot in season 2 particularly is she's finally on a good mood medication because she does have pretty significant anxiety and depression. And that causes her to gain a lot of weight. And so then that's leading to even more self-consciousness as if she's not already self-conscious enough about her tics and all the other stuff that's going on for her. So I'm trying to think of, so her and Colin, they get an apartment. They got a couple little doggies. They're living a cute little life. But Baylen can't cook because of the severity of her tics. It's dangerous to be in the kitchen, near fire or open flame, near knives. Right. So she actually does a really good job of kind of researching what is out there. And she finds these knives that are plastic. So like you can cut into like fruits and vegetables and things like that.
Right.
You can cut into other things with more pressure. But if she was to like hit herself with it, she wouldn't hurt herself.
Okay.
she finds this thing, which I've seen in a lot of places, like it's a cover for the stove. So when she's not actively cooking, like the stove is covered, so it's not tempting.
Right.
She has an electric stove instead of a gas stove. So there's ways that they're working around it so that she can, because the other issue is Colin is working full time. So Baylen's home alone a lot. And then that can kind of open up the door for some difficulty as well. So season 2, they get engaged. And so then they're trying to find a wedding venue. And that's another obstacle for Baylen because, you know, she wants to be able to be free and be happy on her wedding day. But then she's worried about, she has a big fear of storms. So she's like, well, we can't have an outdoor wedding venue as much as she would like that because if there's a storm, day's ruined. But then she wants something that won't be so echoey with her tics. So something that maybe she can open up the space. They find this beautiful place in, I want to say West Virginia. No, Virginia. Yeah, because his parents live in Virginia, so it's near them. And she, you know, that's kind of where, I believe that's where the second season ends. I know that they found the wedding venue. You haven't seen any wedding stuff yet. What else is going on? Oh, so she has 5 siblings, and of her siblings, there is some rumors, some discussion that one of her younger brothers may also have Tourette, but he's not been diagnosed. No, Baylen was not formally diagnosed until she was 17, but she was really struggling for quite some time. And they did get progressively worse over time. It didn't start off as bad as they are at present in the show, but she wasn't diagnosed until she was 17. And something that her parents talk a lot about, the struggles that they had. She definitely had some suicidal ideation and some really big struggles. But they said that her tics started when she was about 6 or 7, and they intensified during the pandemic. And then she wasn't diagnosed until sometime after that. But one thing that they talk about is that they said it was really hard to get a diagnosis. And I question if that is due to like access, like where they live, maybe communication, especially like when she was really little, because she may not do it in the doctor's office. So, you know, parents communicating clearly or even knowing like what to say or how to describe it. If you've never had a child who does this before, you don't really necessarily know how to communicate that to a doctor. Or you go to a pediatrician, and unfortunately, a lot of pediatricians tend to dismiss parental concerns, especially if it's like the first time a parent's bringing it up. Oh, well, like wait it out, see what happens, you know, and then things can kind of escalate really quickly with stuff like this.
And also probably, you know, we'll say 15 years ago, people weren't taping everything on their phone. Now,
exactly.
You know, I mean, you would video your kid and bring that in, but that's not always, you know, that wasn't always the case back then.
Right. And I'm glad you brought that up because that's kind of how Baylen kind of rose to fame per se, was the way she got the show on TLC. It is on the TLC network. Sorry, I forgot to say that before. Is that she was doing a lot of TikToks about her tics. No pun intended. And explaining, you know, like her life. She would do all of these really cute, like get ready with me videos, but then she's ticking throughout the videos and talking about her experiences. And so she really gained a big social media following prior to. So at the time of the show's premiere, she had 10 million followers on TikTok and 1.4 million on Instagram. And that was before the show started.
Wow.
So she definitely has more now. So I think that's another thing about Baylen is she's very open about her tics and her situation. She tries not to let it stop her, but we'll talk a little bit about some of as a mental health provider, there are some things that I think that maybe she could be doing better or her family could be supporting her better in, because I see, at least in the first and second season, a lot of avoidance behaviors, which isn't really helping manage stuff. But also, you know, I'm not her, I'm not living her day-to-day life. So there might be good reason for the avoidance behaviors, but for anything that's causing mental health issues, the more you avoid it, the worse it's going to be to handle in the future. But we'll get into that in a minute. Where was I going with that? Oh, so she had all these followers. She was doing TikToks. I don't know. I mean, I'm guessing she could probably make money that way if she's not working, you know, a traditional job.
I mean, you have that many followers, you're definitely monetizing. So
yeah. And then obviously, you know, she got picked up by TLC and now they have the show. I believe there's going to be a 3rd season. I'm looking to see on here if they have anything about it. So as I said before, the reason it came to, I had heard about it, but I didn't have much interest in it. From the little clips I'd seen, like commercial wise, I was just like, okay, somebody with Tourette's, whatever. But my mom was watching it, and the very first thing that Deborah said to me is, she's faking. And I was like, why would someone fake that?
Yeah, that's.
And so then I was watching out of curiosity, like, does it look like she's faking? And then there's a quote here that Baylen often says that people say that she's faking Tourette's. Why would she do that? Why would she want to have to live like this? And what I think is happening is I don't think she's faking it, but I do think her tics are the show.
Right.
So she doesn't have them.
Right.
So I do think she puts herself in certain situations that maybe are setting off her tics or making them worse. I think sometimes, because I said like she gets set off on things, I think maybe sometimes she puts herself in a situation where she knows she's going to get set off.
Right, for the
Because
camera.
a lot, I would say at least 50% of the show are these funny, awkward incidences because of her tics.
Right.
And I'm glad that she has a good sense of humor about it and that she and her family can kind of show what it's like to live like this. But I also feel like if you really wanted to address your tics, if you wanted to reduce them, and not everybody necessarily maybe wants that, there are things that she could be doing that would be helping. And I don't know if she's necessarily doing all those things. She does talk quite frequently about different medications and the side effects and how she was not willing to try those things, which may have helped reduce the tics. So also that's a personal opinion. Like I was saying, she was taking this medication and she had gained quite a lot of weight, and now she's getting married and looking for dresses and feeling, self-conscious. So weight gain is a very common side effect. And I could see how maybe that's not for you, but she actually chose to stay on her medication because she felt like it was really helping her mood. Right. And so she went and talked with a neurologist about it. The neurologist recommended some GLP-1s. So, she was able to work through that, or at least, as far as the show is going, she's able to find a medication that feels good, that works well, and then still be able to manage the weight concerns so that she can be herself. I'm trying to think of some other, like, for somebody who's not seen the show to see what it's like. I mean, a lot of it is, so Colin, her fiance, his family is very, very, very traditional, religious, soft-spoken, very polite. And she'll just have these tics about like his mother, like having sex with people.
Oh God.
And it will happen in front of his mother. And she's like, oh God, I'm sorry. And like, she's so sweet. Like you can tell she just like adores her and like is so glad to like have her as like a sister-in-law, because like her face might be like, ooh, but like immediately like drops off. And she's like, it's just Baylen. Like, this is what happens. But yeah, there's a lot. I want to say her name is like Marianne or something, but there's a lot of tics about her that are not appropriate and are really difficult to manage. A big one that comes up a lot that they don't really show how this gets managed, but I'm like, it can't all be rainbows and sunshine. She has a lot of tics about weapons, about I have a gun. I have a gun. And so there are 2 different times where she's in airports and she's saying that.
Oh, geez.
And I mean, I'm sure they have some sort of documentation that she has Tourette and that there's things going on, because that's the other thing with the airport. I don't know if this is due to the motor tics or just because of the overwhelming stimuli, but you often see her in a wheelchair in the airport. Physically, she doesn't have any limitations, but I think maybe it's so overstimulating.
Yeah.
But there's one time where she decides even though she doesn't have any plans right now to travel, she's going to go get herself a passport. So she has to go to the library to get it. And there's a sign like outside the library, like, please be quiet, like no weapons. And then she's like walking through the library, like shouting at the top of her lungs, like, I have a gun. I have a gun.
No.
And then there's this one point she's like, I have a gun. No, I don't. I really don't. I promise. It's just, yeah. And then the lady who does her passport is like so sweet and like so unfazed, like doesn't even like acknowledge the tics. And then she's like, I'm sorry, I have Tourette's. And the girl's like, okay, sweetie, like no problem. And so she does encounter a lot of people who are just very accepting. But I also put this in context. She's being followed by a full ass camera crew.
Exactly.
So I'm sure people are already asking questions and they're like, oh, okay, I'm not going to be an asshole on TV.
Exactly.
Although there are several like public scenes where people are giving her like dirty looks or like laughing and like making fun of her. And I'm like, okay, so that's probably what a lot of people, how they react to her.
In real life. Yeah.
It's not okay, but like there are people having those. Sorry, I was reading the list of titles and some of them are her tics. One is, she said, giddy up a lot.
But that's a fun one.
It is. Well, and then she wants to exercise. So she goes to an exercise class with Colin. And it is, those ponies that are just the stick, it's just the head. It's an exercise class of that.
Okay.
And like, of course, it's like ridiculous and silly for the show, but the entire time she's like, giddy up.
Get up. Hey, it was appropriate there though.
It was appropriate there. But yeah, I think a large part of the show, filming her in public, unfortunately, is her explaining or apologizing to people. Yeah. And so I can see why you might not be as apt to go out or to want to have a job or to go places, because it's going to be constant, especially if you have like a public facing job or role, having to constantly apologize or be overstimulated and set off by things. But as I was saying before, she has 5 siblings. One of them may have Tourette. One of them, they never exactly say, but he seems to present as though he may be on the spectrum or have some sort of neurodevelopmental disorder. And then her younger sister, she's the oldest, her younger sister has severe anxiety, which actually towards the end of season 2 is kind of impacting her involvement as her maid of honor in the wedding. She doesn't live in the same state and she really struggles with getting on planes and traveling. And so there's some difficulty around that she's struggling with. At times, her mother references that like, oh, all 5 of my kids have diagnoses, but they don't necessarily talk about all of them. Not, it's not the other kids' shows. So unless they want to share, but you can tell that they all have something going on.
Yeah. So I imagine there's definitely some genetics going on there for sure.
Yeah. Like I said, her sister has OCD and she's open about it. Her sister talks openly about having OCD, and the anxiety associated with the OCD can be really difficult for her. And then the brother that they suspect of maybe having Tourette, he is a personality. Like when he is on the screen, it's all about him.
Aw.
And I've never, at least when they've shown him, I've never seen anything that looked Tourette-like to me, but maybe it's more behind the scenes that they're seeing it. Because he's a big personality. He should have a show of his own.
Cute.
So that's Baylen Out Loud. So one of the main things, well, there's 2 main treatments they talk about in her show, and one of them is CBIT.
Yes, I did see. I read a little bit before I got on. I was like, I need to know what she's going to tell me about therapy.
Yeah. So CBIT is a type of therapy where it is cognitive behavioral intervention for tics. I might be wrong on that one. Cognitive behavioral intervention. Either way, basically what you're doing is
CBIT, right?
Yes, CBIT. I just don't remember what the I stands for. Sorry. Oh, I was right. It's comprehensive behavioral intervention for tics. Sorry, I got it confused with CBT, which is cognitive behavioral therapy. So comprehensive behavioral intervention for tics, basically what it is the therapist is working with the patient to become more aware of the tics and the triggers. Tics often come with an urge, so you may feel the need to do that before it happens.
Right.
I've heard people describe it as a little bit like
a sneeze coming on?
Like a sneeze coming on, or like when your hand is going numb, like when it's falling asleep, like that kind of like tingling sensation. And so learning those cues, both either the external cues or feeling those internal cues, and finding either replacement behaviors or reducing the tics. So there's something that Baylen learns in her CBIT where instead of saying her vocal tics out loud, whispering them. So she's still expressing them, she's still getting them out, but trying to manage the volume. And then, or trying to do replacement behaviors that are more socially acceptable. And then making changes in day-to-day activities that can be helpful in reducing tics. So I think some of the stuff she's doing is part of her CBIT in avoiding certain overstimulating situations and things like that. I think other things that she's doing have just been, it's been her comfort zone to not go to quiet places because she doesn't want everyone there to hear her ticking. So she rarely goes to libraries. She doesn't go to the movies. She doesn't go to amusement parks. She doesn't go to like lots of places. But then I'm thinking, what a small life this 20-something-year-old is living. And thank goodness she has her social media following and she's connecting with people still. But it seems like a very insulated life to be living if you have to avoid everything. Yeah. And so I think CBIT is interesting because we know for a fact that Tourette is a neurological disorder. These are not purposeful tics.
Behaviors, right.
But it's learning when those things are coming on to be able to calm down, to regulate better, so that way it doesn't continue a loop. So you might still have maybe 1 or 2 tics, but instead of having 10, maybe now we can reduce it by learning these more behavioral or cognitive interventions.
Interesting. Yeah, because I was going to say, we're saying it's neurologic. It's almost like a seizure. It's a misfire, but we're using a behavioral technique to just manage it, but you're not treating it.
Right. It's managing. And I will say, I am not trained in CBIT. I know very little about managing tics and tic disorder as a practitioner, but I know that those are therapies that are out there and I would just refer to the correct people to do that. I do think it depends on the individual, the severity of their tics, the willingness they are to work on them and to manage this stuff. Because I think there does need to come to be some sort of acceptance of this is what I have, this is what happens, and I'm okay with that. Now let's work on making it more manageable. Right. Because I think if someone is very self-conscious or very sensitive about talking about it, you're not going to want to address it in talk therapy.
Right, of course.
Yeah. Did you have a question? It looked
like
you were
I was going to say,
something.
I can tell you a little bit about the meds because I did look that up a little bit beforehand. So medication management is a big part of this. And one of the first line things they use is something we use in ADHD sometimes, guanfacine and clonidine. Those are actually blood pressure medicines. They're alpha-2 adrenergic agonists. and we use them for like impulsivity and things like that in ADHD, and some anxiety and things like that. You can use them as well. And so it's interesting because that's like you were mentioning earlier about treating things like ADHD. So stimulants, which we are the cornerstone of ADHD, would make
Can
this
exacerbate
worse.
tics. And that's often, I've seen how that is how tics are discovered. When a child who very clearly has ADHD is then put on a stimulant medication, and now all of a sudden they've got a million tics, and they're like, oh, it's the medication causing the tics.
Right.
Many times those tics were already there, and now they're just amplified.
Right. And then next line beyond that would be dopamine blocking agents. So we would talk about some of the second generation antipsychotics. So Risperdal, aripiprazole, that one.
Abilify.
Yeah, Abilify, like Zyprexa, those type of things. But those are the ones with the weight gain. So you have to be careful of the metabolic side effects with some of those. And then the old antipsychotics.
I was going to say Haldol is a big one.
Yeah, but that's supposed to be like third line. And then Botox can be used if you have a very localized facial tic.
They're using Botox for everything these days.
Yeah, they use it for migraines. It's good stuff. But yeah, for like a very specific, so if you had like, say it was like your jaw, like you could do that to relax that particular muscle. So that's pretty interesting. There are some newer things, but
I was going to talk about deep brain stimulation.
Yes, I saw that listed too. But there's something else called VMAT2 inhibitors. They're considered for refractory cases, but I don't know what they are. It says requires specialist oversight and monitoring for mood and Parkinsonian adverse effects. So whatever that is, they could cause, I guess, like tardive dyskinesia type things.
Yeah. So I was looking for it, and of course I'm not finding it as I'm looking, but a big thing that they discuss on and off in Baylen Out Loud is deep brain stimulation due to the severity and the amount of tics she has. You know, like I said before, she definitely is one of the more severe cases out there. So it's not like she's just got one or two little things. She has constant daily tics, both vocal and motor. And so she definitely needs that more significant type of treatment than other people may be looking into. And so there's a lot of conversations about deep brain stimulation, but she is not willing to do that type of surgery, which I can understand. That being said, it can be very, very effective, but it's brain surgery. It's literal brain surgery. So I can see some of the hesitation for her to explore that. At the end of season 2, and like I said, I didn't finish all of season 2. I think I have 2 episodes left. There is a treatment in England that she is going to go on a plane.
Oh, I wonder if TLC is paying for it.
To find out about this treatment because it is not approved in the US yet, but is essentially some sort of bracelet where when you're wearing it, it's sending, I'm guessing it's kind of similar to the deep brain stimulation where it's sending electrical impulses, but it's more of a wearable device.
Okay.
That is being trialed and has shown good effects in the UK and Europe. And so she's considering going over there to try that because it's less invasive.
Okay.
I don't know what the outcome is. I have a feeling that TLC is going to leave us hanging on that one.
I'm sure.
About how it works for her. But it's definitely something that she talks with her neurologist, who is phenomenal. She's a really good neurologist in the show. Talks with her about it. And the neurologist is like, we don't have it here in the US, but like, if you can make it over there and try it out, like, why not? Like, we're not cutting into your brain.
Exactly. It's not invasive. Why not?
Yeah. So one thing I forgot to talk about before is complex motor tics involved copopraxia. So now knowing what copolelia is, what is copopraxia?
I don't know. You quiz me too much on these things. So praxia. Okay. So I know
praxia is motor movement.
Yeah. Yes. So it's
obscene or forbidden gestures. I just gave you one. Movements. I was giving you the finger and you didn't realize
I closed my eyes. I turned like, okay, so obscene gestures. So I could.
So it can be like giving the finger, but it can also be, you know, like grabbing your genitalia, grabbing others, things like that. Echopraxia.
You're copying like what people are doing?
Yep, you're repeating or imitating the movements of someone else.
Okay.
And then palipraxia, so repeating your own movements. So picking up a glass up and down
over
10
and
times.
Over. Right.
Yeah. So you have got the copro, echo, and palia in both the speech and the motor.
Got it.
And those, again, are the more complex, significant ones that you don't see in as many people. I feel like I haven't seen Baylen do any of the echoing, both verbal or motor, but she does do both repeating herself and the coprolalia and the Copopraxia, she'll give the finger. I think that's the worst that I've seen on the show.
Okay.
But she will do that. I'm trying to think if there's anything else specific to Baylen. I think that's all that I had. Did you have any questions?
No,
about
I'm interested
Tourette's or Baylen?
Yeah, no, I'm interested. I'll have to go binge her show one day when I have.
Well, it is on. Is it Peacock or Hulu? It's on one of the streamings.
Right.
So you can watch it all there. Oh, the last thing I want to talk about that's kind of cool, on the Tourette Association of America. And I talked about this in relation to something else, and now I'm forgetting what it was. But brain tissue donation. They're also doing studies on brain tissue donation for Tourette as well.
Interesting.
It was something else that I covered, that they were doing brain tissue donation. It's absolutely something I talked about in the past.
That's not even something.
I'm sure it's in our show notes somewhere, folks.
Yeah,
you can find it there. But essentially, and I know that they do it for autism as well. And this is obviously post-mortem, donating your brain tissue for further study. So it's not something that you're just going to go in and you're going to shave off a little and you're on your own. This is something after that you have passed to help advance research.
Cool.
And it says that it looks like they give you all the instructions. It seems like it's kind of targeted towards people who are near end of life. It's like, if you live in a nursing home or a care facility, notify your administrator of the decision or things like that. But
interesting.
There is definitely something there. I just brought it up. This is just
if their website has, I know some of the really rare disease websites have referrals, where you can find a therapist in your area who specializes in this.
Yep.
Okay. Because that's cool. That's a great resource for people.
Yeah. They've got a find a provider tab under find support, and then it's even sectioned into children, adults, teens.
Perfect.
They got a lot of really good resources on their website, and that'll be linked in the show notes. And of course, now the website isn't loading when I click on find a provider, but it's there.
It's there. Yeah, no, that's cool. Because I remember when we did the Ehlers-Danlos, that was a great resource that I've gone to find people to refer patients to. So
yes.
Because I don't have a magic book of who specializes in something, that's not super common. I'm sure even yourself, if, you need to find somebody in your area to send someone to who does this particular type of therapy that maybe you don't do, it's tricky. You don't always have just that list somewhere.
Yeah. And on this site, they have, I'm looking for someone for myself, for someone I know through my profession. So to get education and training, there's toolkits and guides, there's advocacy, volunteer events. TicCon 2026 is coming up. TicCon 2025 was in Texas because Baylen went and she presented. She was I don't want to say a keynote speaker, but she was a speaker, and she was very nervous because she'd never spoken at a conference before. This year is in Tennessee, so I'm guessing that she may be going because it's a lot closer to where she lives.
Okay.
But I don't know. I'm not planning Baylen's schedule for her. She's got a wedding to plan. She's got other stuff going on.
I'm sure they're going to have another season just for the wedding.
I really hope so. I want to know. I mean, the place they picked was gorgeous. I literally Googled the place and found it. And I was like, wow, how much does it cost to have a wedding there? But yeah, one thing that comes up in the show, this is not really so much related to Baylen, but I loved Colin season 1.
Mm-hmm.
And then Colin season 2, I've mixed feelings on you. Sorry, Colin, if you're listening. I know you're not, but he gets a little I don't want to say demanding. I think he's trying to kind of affirm his status of I'm her fiance. I'm going to be her husband. I'm going to handle this. This is me. Stop relying on your parents. But her parents basically have a conversation with him because he's getting out of the military. He does not want to continue that work. And they basically are okay, well, that's great. But, Baylen has a lot of medical issues. She has a lot of doctor's appointments. And so you want to make sure you have a good job with health insurance.
Right.
And he's basically F that. I'm doing what I want to do.
No.
I'm going to go into real estate. And it's there's no benefits in real estate. There's no steady income. And he's just kind of you can't tell me what to do. I'm going to do what I love, which I feel I think that is the clearest reflection of how young they are.
Right.
Because he's just this is going to be fine. We're going to handle it. It's not a big deal. It is a big deal.
No, she needs specialists, and she needs people who are going to be able to continue to follow
and
her.
Then he wants to have kids, and then he's well, can you go off your meds when you're pregnant? And it's I like that you are thinking of having a life with this woman, but also there's a lot of logistics here. And she's yeah, I'm not anti babies and stuff, but she's we got to figure all this other stuff out.
There's a lot of logistics to that too with her,
And then the larger issue, like I said before, at this point they're saying that she cannot work. So, to raise a family on one income That's
Right.
a lot. It's a lot of
Right.
pressure, and it's rough. And so he's butting heads with her dad a lot about things. And then her parents are trying to be really sweet and like help figure out like the right wedding venue. They offer to have it at their house to save money so they can save money for a house in their future. And they're like, no, we're not having it at your house. You're going to, you're going to run our whole wedding. And it's like,
Okay.
they're just trying to help you out.
Yeah.
Her parents put on this beautiful, adorable little engagement party for them as like a wedding preview. Like if you had the wedding here, and it's gorgeous. And they're still like, no. Well, Colin's still like, no. And you can tell Baylen does love the place that they went to see. So I think she did get to make the decision that was best for her. But I feel like his, I don't want to call it immaturity. His youth is showing.
Right.
In some of the ways that he's reacting to stuff and saying that like her parents are too involved and she's too attached. And like, but she's a person who's got significant, severe medical needs.
Right.
And like there's this really, her parents are so sweet, but there's this one scene that it just kind of gets me every time where Baylen was really in crisis. And I think she was away at school and the dad went to go get her. And she was on the floor basically like telling him that she was going to die. She was going to kill herself. And like this is now like years later and she's in a wonderful place, but he's still racked with guilt about that. And he's traumatized by it. And it's like, at the end of the day, this dad's just trying to look out for his little girl. He's just trying to look out for his baby girl.
No, yeah. When you've got a complex child like that, of course you're going to not want to let go. And I'm sure she relies on them quite a bit. So
She does. Now, I will say, her parents aren't perfect. When Colin went to them to ask for their permission to propose, the dad basically said no.
No.
He was like, I'm not going to stop you, but I'm not on board. So, he didn't play that one well for himself, but, they've moved forward and obviously, they threw them an engagement party, so they're on board now. But I can see why Colin's a little hesitant about the dad, but the dad's just a big old teddy bear who just wants the best for his baby girl.
No.
Yeah. So they're a really sweet family. Like I said, the one brother is hilarious. I'm blanking on his name. He has like an unusual name. Like Baylen's not a common name. I forget what his name is, but he's a character too. And just kind of showing how they navigate having one child with this severe issues, but then also knowing that their other children have problems. And they do talk about briefly, like, the other children have made sacrifices for Baylen. Like the one younger brother, it's his birthday. And he's like, oh yeah, we'll just have it at home because Bay can't go out. I wanted to go to the arcade, but she can't go. So let's just have it at home. And it's like they do make sacrifices for her. Cause you can see they're a very loving, close knit family, but also like, why should her little brother have to make sacrifices? Like maybe Baylen shows up a little and then like leaves if she needs to, or comes at the end, or like, letting them all live their full lives. But I think as parents, they're very protective of all of their kids, which I get, they're being good parents, but maybe they're being a little bit too tight sometimes.
Right.
And maybe that's what Colin is really kind of fighting against. It's just not coming across.
Remember, reality TV, they like frame it, in a very certain way and show you.
I don't know. Season 1, Colin, I was on board. I was like, I love this guy. He's amazing. And then season 2, I was like, why is he kind of a jerk sometimes? So I don't know. Maybe he's getting more comfortable with the cameras in front of him. Maybe he's just more annoyed with the family now that, he's the fiance, and who knows? I'm sure there's lots of factors that go into it. But Baylen is Baylen all around. She don't give a F. She's going to be Baylen, which I do love about her.
That's good. I respect that.
Yeah. So more to come. Hopefully there's a season 3.
Thanks, Deb.
Yes, thanks to Deb. But in their defense, literally season 2 just ended 6 weeks ago. So,
but thanks for the suggestion though. That's a cool one.
So Deb still thinks that Baylen's faking, even though I explained to her how Tourette works and that I don't think she's faking. I do think she is putting herself in situations so that makes her tics worse.
Right.
And maybe it's for the show. Maybe it's not. I don't know.
All right.
But the going to the airport and I have a gun. Because she says it exactly like that. She's like, I have a gun. But like, that's not how she talks. So it's like even like kind of like scripted.
Like robotic almost sounding.
Yeah.
Oh my goodness.
So that's Tourette's and Baylen. And the Tourette's Tippler was tipping me up. And I literally had like 2 sips. And
make you a little warm and fuzzy inside.
If you want a drink that's going to make you tip over your words...
That's the one.
This is it for you.
All right, everybody. Thank you for listening to Medical Media Mixer.
The perfect cocktail.
Cheers. I have a giant water bottle.
Water? What's wrong with you? How dare you hydrate? Rude. Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon, patreon.com/Medical Media Mixer Podcast, and on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.